Great, thank you very much for joining us, guys. So today we're going to be talking about interviews and how to get what we call a number in plastic surgery. So that's a training period where you, at the end of it, should be a fully fledged consultant, and you can apply for consultant posts, but they are hugely competitive. Now you guys are super clever and you've both got numbers. So could you tell us who you are and when you got your number?
So my name's Tenni, I'm a plastic surgery registrar here at the Norfolk and Norwich, and I got my number around 2 years ago.
Okay.
My name's Hamza, I am a core surgical trainee in Norfolk and Norwich, and I just got my number this year, so I'll be starting in Birmingham this year as an ST3 in plastic surgery.
Great, congratulations. So we will start off with, how did you decide that you wanted to go for your number in plastic surgery?
I think that was an interesting and long thought process. During our training, we have our foundation years and then core training years, and during core training I ensured to get plastics themed core training posts. Some people do prefer to get some time in trust grade roles to be able to build up skills, confidence in terms of the registrar level before applying to getting their number. But I felt that you'd be able to get more guidance in terms of support from the consultants if you are in a numbered post, because everyone in that position wants to see your progression. You're in a place where your progression is everyone's key priority. So I thought it'd be best to go through it straight from core training. So that's why I made my decision to apply whilst I was a CT2.
CT2. And how about you? When did you decide?
I was actually about to leave medicine in about year 5 of medical school.
Wow.
I went to UEA, so I just decided to pick plastic surgery as my intended elective because one of the consultants over here was very nice to me and took interest in teaching. He was an anatomy teacher here. And that changed everything. That got me into plastic surgery, interested in. I chose all of my placements following that years geared towards getting into plastic surgery, and yeah, here we are.
Great. So you've recently got your number.
Yep.
How did you prepare for it? The interviews.
The interview, yeah. The interview is very competitive. It requires a lot of prep, but also a little bit of luck, to be completely honest. There's quite a lot of applicants and they're all equally prepared. We start early. I started in around October time, so October 2025, for an interview that was in early Feb 2026. And it was a mixture of taking advice from people who had done the interview before. I didn't really go to a lot of courses, although there are several courses and a lot of people do go to them and they find it helpful. But I found that actually tapping into my network of people I've worked with, consultants at Norfolk and Norwich, at Broomfield, at any unit, at Swansea units I've worked in, who were really helpful, who sat down with me, did interview prep, and I think that was the key factor in getting a successful number.
So you did lots of interview prep with people.
Yeah.
And was that similar for you as well?
Yeah, so I was similar. I probably started around October, but our year the interviews were in April. I practiced with a close study buddy, I practiced with the registrars I'd worked with, and once I felt confident enough, started grabbing some consultants as well. I did have a period of time where I was also, before actually starting interview prep, just making sure I was comfortable with my baseline level of knowledge, so more on looking at things alone and going through textbooks, and then I worked my way up.
Fine. So what textbooks were you using for your interview prep?
So there's an ST3 interview book that was really useful. So I used that as a baseline in terms of the types of cases that were going up, that could come up. And then I'm looking at things such as Keynotes in plastic surgery as well.
Okay, did you read that first before you started to prep?
Yeah, so I looked at those books together, and then once I felt like I had a general understanding, started more interview focused preparation.
Yeah, and how about you? Did you use any textbooks?
I used Keynotes in plastic surgery.
Yeah.
So my strategy was that in the first few months it was all about knowledge building and consolidating. So I spent the first few months just going through Keynotes in plastic surgery. It equips you with basic knowledge, foundational knowledge in key topics within the specialty. And then it was all about practicing, because you have to be ready for an element of surprise. For example, this year they last minute changed a station that traditionally we used to get a consent station, but this year we got a prioritization station. And the only way you could be prepared for that is if you were used to having an element of surprise with variation in your practice, which luckily I was, so I wasn't too confused by that.
Yeah. In terms of the questions, How did you know what kind of questions that they were going to ask you? How did you figure it out?
So I found that, lucky enough, when I was practicing with the different registrars, they all kind of had a theme and flavour of what they'd experienced anyway. So we were able to split it into the general plastic surgery subspecialties and then review what could come in maybe as an emergency case, return to theatres and things like that. And then also what might present maybe on more of a clinic level and patients that we might see on an outpatient basis as well within the different subspecialties. So we try to cover our bases throughout those and also think what are the key things that we would need to know as a registrar. And
did you speak to anyone about previous people that had taken the interview and get those questions from them? Because
yeah, absolutely. I think that's the key. Everyone has their own experience of interview, and you learn something from everyone. So the most, starting off with people who've just done interviews, so ST3s, and there were various ST3s from different units who helped me, and then going all the way up to consultants who can then ask you those really challenging questions that might put you at an edge during the interview day.
Fine. And so on the morning of the interview, how did you prep?
I think everyone has their own ritual. I actually wanted to get the first morning slot, but I missed that, so I got the early afternoon slot. And for some people don't like to do anything. I like to just go over everything because the more I can cram into my short-term memory, the better. But again, practice. I was just saying everything out loud, getting my voice rehearsed so it's not croaky, not the first time I'm speaking, getting into a nice, comfortable environment, making sure I feel comfortable with myself. Yeah, that was my sort of routine.
How about you?
Mine was probably a bit different from yours. Definitely did not touch any books, did not touch any notes. I was about my calming morning routine and ritual, make sure my lights, cameras were all working well, make sure my seat was comfortable, make sure I didn't feel too hot or too constricted in my jacket.
Yeah. Was it all online? It was all online?
Mine was online, yes.
Was yours online?
Yeah, it was, yeah.
Okay, so because of that, this is going to be an interesting question. What did you wear for your interview? What kind of image did you want to portray in your interview?
It's funny because actually one of the registrars gave me advice that you need to feel comfortable and confident. He said that they wore a shirt and then shorts underneath because no one could see those.
Yeah.
I was not as daring. I just wore a shirt that I liked, I felt comfortable in, and normal formal trousers. And so I was dressed formally like I would be for an in-person interview. For me, I prefer in-person interviews, so in my head to recreate the feeling within myself that I'm going for an in-person interview was important.
And did you wear a blazer?
I didn't know. It was too hot, I think, at the time.
But you just wore a smart shirt.
Yeah, I wore a smart shirt, smart trousers and smart shoes. And made sure, I think the key thing actually is to make sure that the height of your laptop camera meets your eye level, so that when you look into the camera, which you shouldn't be looking at the screen, you should be looking at the camera. A very small thing makes a big difference. It looks like you're making eye contact.
Okay. And how about you? How did you physically prepare in terms of what to wear?
So I actually did a colour analysis
to
see what colours would suit me best so that I could feel my best. I think if you look good, you feel really confident, you portray yourself really nicely. I know it's quite smart that you want your background to be quite light and you want what you're wearing to probably be the darker colour. You don't want to blend in with the wall. So I was like, what darker colours still bring out the light in me and make me feel nice and confident? I think the aesthetic I was going for was probably quite polished, probably what I'd wear to a clinic or to a conference. And I ended up actually going for a black Oasis blazer top with some gold buttons, which I think did great. And then some earrings that my grandmother had got me.
Take that advice over.
So I think just all those things to make you feel kind of smart enough. I did wear trousers, but I didn't wear smart shoes, I wore no shoes, to still feel comfortable. So you want to feel smart enough, but you also want to feel calm and relaxed in your space.
So it's interesting you picked a light background. Did you think about your background?
I did not. No. I was very limited. The most important thing for me was because I had spoken to quite a few of my people who've taken interviews before, and one of the problems they had were tech glitches. They had internet being too slow because the software actually takes up quite a lot of bandwidth. So for me, it was really important to be close to my Wi-Fi router. I actually increased the bandwidth and the speed of my Wi-Fi just the day before, getting a wire connection. Those things were more important, and that they kind of selected the only spot that I could be in the house.
So you were
more than
limited
anything
that
else.
way. Great. When you had your interview, how did you feel afterwards? Because I think
That's a very good question.
Yeah.
That's a very good question, because how I felt afterwards is not at all what I thought I would feel afterwards. I felt it was very anticlimactic. I thought it was going to be, because I'd been preparing for this for so long, and there's going to be this release, but there isn't. You just feel, if I'm completely honest, I can't believe I spent this many months preparing for an interview that lasts about 20 minutes.
Yeah.
It's over before you know it, and so much of it is out of your control. This isn't to say that you shouldn't prepare for it. You should, but also you should try to be balanced and keep continuing with other things that you're doing in your life.
yeah.
That's my biggest takeaway. If I'm to do something similar to this again, that's what I would do.
Yeah.
And this is my on-call phone going.
Yeah, fine. How did you feel
Hello?
afterwards?
Quite similar, actually. Probably not thinking about all the time I'd put into it, but there's
Hello?
so much going on screen during the actual interview, and then once you finish your final session, everyone's gone, and you just kind of left with a blank screen video and a reflection of yourself, and you're like, is that it? Can I move? Is there anything else? So I think I was probably just at first probably left in a bit of state of shock, and then I slowly was like, okay, I guess we carry on with our day.
Yeah. And so you've had your interview.
Yeah.
It's all a bit anticlimactic. What did you do to get your mind off things, or did you try and get your mind off things during the wait period of getting the results?
Yeah, well, another good question. I think the wait period can be very difficult.
Yeah.
And for me, it was difficult because I like to discuss my interview, my exam with my peers who've taken it. But the peers I'd been preparing with were the sort of people who didn't like discussing. So unfortunately, it was my wife who had to listen to everything. Yeah, so for me, it was nice to talk about it. But honestly, I pretty much forgot about it after a day. I was doing a plastic surgery job, so it was nice to get back and actually focus on going back to theatre, learning the technical skills, which are going to help me for the next year. And that's how. In the immediate time afterwards, I think because I was home alone, I probably just started watching a film.
Yeah.
I think also because we have, I don't know about you, but I took quite a bit of time off, maybe like a week and a bit before the actual interview, away from clinical duty. So it was actually quite nice to go back to being at work properly again.
Yeah.
True.
So how long did you wait before the results came out?
Too long, really.
Yeah.
Your cohort didn't wait very long.
Yeah, I think we were about 5, end of the month, so maybe 4 weeks or so.
That's still
Yeah.
quite a long time.
For us, it was almost 2.5 months.
Gosh.
Yeah, it felt like a really long time.
Yeah.
But hey, it goes by.
Yeah.
You're just glad to be not revising every day
Yeah.
and just have your life back. It's a great period. This
Yeah.
period is the best period because you know you've got a number, or at the time, you know, it's out of your control, and you're just focusing on being at work, being at home, being with your family, friends,
Yeah.
and work peers, and having
Were
a
you
good time.
confident that you got a number?
Absolutely not. You can't be. I think because so much of it is dependent on factors outside your control. Every single person who gets an interview is a very competent candidate, is very well knowledge rehearsed, and honestly probably deserves a number. It's just because there's so few numbers, it's factors like what happened on the day, how you were feeling within yourself, how confident you came across, how smooth you came across, all of those factors that could happen to anyone. So yeah, no one was confident, I don't think.
And did you feel that you got your number as soon as you walked out?
Absolutely not.
Yeah.
I was like, have I absolutely ruined my chances of getting a number this year? I think that's probably like my mindset going into quite a few interviews anyway. You give it your all, but I think you just have to kind of give the rest up and see how
Yeah.
things go.
And you both got numbers first time round.
Yeah.
Well done. So you are
Thank
super
you.
clever. So what we will do in the future, we'll talk about some practice tips and tricks and what advice you can give our people out there. Great.
Well,
Thank you
people
for
have
your
to
time.
subscribe to your channel for that.
No,
Yeah. Subscribe!
Subscribe.
All right then. Well, thank you very much, and we'll see you guys again.
Thank
See
you.
you.
Bye.